Good afternoon, everyone. Like Gal said, I'm Gloria Miller. Gal, did you say most people did not attend?
Most people, it looked like most people attend.
Attended. Good, great. Welcome back. That's great. That makes it a little bit easier, but even if you didn't, everything's fine. So today we're going to talk about how to end poverty and the behaviorally based interventions that are behind these policy recommendations. I'm going to talk a little fast today because I realize that I put a lot of information in this presentation. I get super excited when I get the opportunity to talk about this stuff. So let's get started. I always like to start from the beginning. Well, there we go. So I always start to make sure that we all understand we're all using the same language, that this is the U.S. guidelines for poverty for 2020. These are updated every year. The formula for this was created in the 60s, actually. And so although we do adjust for inflation every year in the United States, the equation that they use is incredibly outdated. So as you can see, if a single parent with 2 children made $22,000 a year anywhere, I mean, here where I'm in Tulsa, but anywhere in our country, that would likely not be enough to sustain their family. And so just remember, this is a national number. Doesn't matter where you live in the country, these numbers apply. So today when I talk about poverty, I'm talking about families who live below these numbers. So poverty in the United States in 2018, we had about 40 million Americans living in poverty, just over 600,000 here in Oklahoma. 18% of children in our country live in poverty, but 26% of the kids here in Oklahoma, so over a quarter of the kids in Oklahoma live in poverty. Children represent about 18% of our total population across the country, but obviously significantly more than that for people in poverty. And then the number of people in poverty is decreasing nationally, but in Oklahoma it's increasing. And then 1 in 3 families is unbanked or underbanked. We're not going to talk a lot about that right now, but later I will refer back to that number. So just remembering that 1/3 of the families in the United States don't have a bank, that becomes important later. So extreme poverty in the United States, this means that their income is less than half of that poverty line, right? So we still have 18.5 million Americans living in extreme poverty. That was 20 million in 2015. So almost 6% of all Americans live in extreme poverty. But if you look at everyone who lives in poverty, nearly half of those people live in extreme poverty. And we'll talk about those people in a little bit. And then in Oklahoma, slightly more than 10% of children live in extreme poverty, which is about 95,000 kiddos. Okay. So I want to take a quick detour. I'm not going to spend very much time on this. It's really only relevant for people who live in Oklahoma, but it's important. In Oklahoma, people always ask me, why are we increasing? Why do we have such high numbers of poverty? There's lots and lots of reasons for that. But one of the reasons, and something we can do something about next month, one of the reasons is that we have rejected Medicaid expansion as a state. We're one of only 16 states that have done that, even though the ACA was a decade ago or so, right? And what that does for our families is it leaves them in poverty when they don't have access to health care. And so for every dollar that Oklahoma refuses to spend on Medicaid expansion, we leave $9 of federal dollars on the table, okay? Here's really quickly some numbers. It's just about $11.5 billion over the next decade that we will not take from the federal government if we do not expand Medicaid. And obviously in our state, that's a lot of money. So why do I bring this up today? Because it's on the ballot next month. So State Question 802 was a ballot initiative, which means we got enough people in Oklahoma to sign something saying we want to vote about it. And it becomes a constitutional amendment if we pass it. Sooner Care 2.0 is Governor Stitt's plan. He does not like 802, so he's got his own plan. It's not something that is a constitutional amendment, meaning as soon as it passes, it can be undone by any governor with a stroke of a pen. If you want more information about any of that, Google State Question 802 or Sooner Care 2.0. Tulsa World did some things about it. Okay, policy has written some things about it. Okay, that's the end of our detour. Now, we'll get back to it. So when we think about today, the suggestions that I give are not new. All of this is, 5 years old. And so we have to think about what keeps us from passing policies that will actually end poverty. I think a big reason we don't pass these things are the myths surrounding people who live in poverty. And so looking at research, it says that there are 3 categories that these myths fall under. So today when I talk, I'm going to give some examples of some of these myths and then what research says about those myths. But all of these will fall under one of these categories. So first are that poor people are individually and solely responsible for their circumstances, right? We hear this all the time. Or that those living in poverty lack the agency to manage their own lives. And then exceptional rags to riches stories show that people can move out of poverty with hard work. I think you all are probably very familiar with these tropes, sure. So let's talk about the first one, the American dream. We've all heard of this, of course. We grew up with it. It's part of our culture. It involves lots of hard work and bootstraps. It assumes that we're all born with equal opportunity, and it blatantly tells us that our choices determine our status, right? Let's see, this. The second myth that we're going to talk about is the welfare queen. So we've all heard of the welfare queen. This is part of our vocabulary now. This started with Ronald Reagan in 1976. During a debate trying to get the Republican nomination, he said there was a woman in Chicago that was a welfare queen that had been arrested, caught, and she'd been scamming the government, had a $150,000 a year salary, and drove a Cadillac. Lots of people thought that he made that person up. In fact, he did not make her up. Her name is Linda Taylor. She passed away in 2002. But the thing about Linda was that her greatest crimes were not that she was scamming welfare. She was an actual criminal who was arrested for much more serious crimes than that. She was also associated with some possible kidnapping. She was linked to 3 suspicious deaths. I mean, her least crime was the fact that she was scamming welfare. But there's a new book coming out about her, and the author of that book, quoted, says, her mere existence gave credence to a slew of pernicious stereotypes about poor people and Black women. And unfortunately, Reagan repeated that welfare queen line and kept talking about this woman all through the 80s. And it reinforced this stereotype that there are women, largely Black women, out there scamming our government. It's not true. And she wasn't a welfare queen. She was a criminal, okay? The next myth, that poor people are lazy and don't want to work. So what does research tell us about that? Well, the Brookings Institute, this is a graph that says, it's a figure, that says, here's everybody in poverty in 2018 in the United States. If we look at the top four categories, these 4 are children, seniors, people who are working, and people who have disabilities. They make up about 75% of everyone living in poverty, okay? So for the most part, if people are in poverty, they're falling in one of these categories. We don't expect children to work. We don't expect seniors to work. We don't expect people with disabilities to necessarily work. We don't expect students to work. So let's talk more about the working age adults. 21% of the working age adults living in poverty have some sort of disability. 15% of them are caregivers. And so they are taking care of children, spouses with disabilities, or maybe aging parents, and they cannot work. Then we have students. So if you move over on the other side of the figure, less than full-time year-round is 25%, and full-time year-round is 12%. So now we're going to focus just on the people who are working part-time and live in poverty. Well, a quarter of them say that they are involuntarily working part-time. And then we have students, caregivers, and part-time for other reasons. So all of that, here's some numbers. It's easier for me to see this with numbers, is that nearly 60% of all adults living in poverty who can work do work. Some of those that don't work want to work and can't find work. But that means that 11 million people who are living in poverty right now, poverty, remember, not poor people, people in poverty are working full or part-time. And the ones who aren't working cite the following reasons. And these are the same reasons. 3.8 are caretakers, 3.8 million. 5.2 million have a physical or mental illness. 3.5 million are students. And then another 2 million can't find work. And we know that that has changed right now. We don't have the numbers yet, but who cannot find employment, obviously this number is pre-COVID-19. The folks are being severely impacted right now by COVID-19. Another of the myths is that poor people are bad with money. There's financial literacy classes for low-income individuals, which on its face assumes that people don't know how to budget their money instead of assuming that they just don't have high enough wages, right? Okay, but research says that actually lower income individuals are better with money than higher income families. And so here's 2 studies. There's lots of other studies, and all of this is going to be in my references if you're interested. There was an Angry Birds study. I hope you're familiar with that. Angry Birds is a game you can play on your phone. You line up these birds and you knock things over, sort of like bowling. And so what they did was they split people into 2 groups. Some folks got lots and lots of opportunities to do this, and others got very limited opportunities. And what they found was that people who had fewer opportunities actually spent more time lining up their shots, and they had higher accuracy even though they had fewer attempts than the people who had almost endless amounts. Those folks didn't really care that much about lining up their shot. They got it right less often percentage-wise, but because they had more shots, they won the games overall. So people with less were less successful. People with more opportunity were more successful. So that's a game. Now let's move to a tablet purchase. This is much more real life. It was research that showed that folks in their demographic information had to list their family income. So, and then after they filled out their demographic information, they were given this word problem. Okay, so the problem is you've been looking for a tablet, you know it's about $300, you find one that is a 30-minute drive away. Do you drive 30 minutes to save $50 because that one's on sale? Or do you buy it down the street and forego the $50 savings? Nearly 100% of respondents, regardless of their self-reported family income, said that they would drive 30 minutes to save $50 for a $300 tablet. Great. Then they gave them the second problem, which was, well, now the tablet that you're looking for costs $1,000, and it's still 30 minutes away for a $50 savings. So what they found was that by and large, folks with low income said, no, I'm still driving 30 minutes to save $50. And people with higher self-reported incomes said, I'm not driving 30 minutes to save $50. It's a $900 tablet. That's barely any money. Interesting. So this is what the researchers deduced from that, was that first of all, people, depending on your income, you will see money either in absolute terms or relative terms. So people with less money saw it in absolute terms and said, it's $50, regardless of the cost of the tablet, I'm saving $50. It's the same amount of money that I'm saving. Where folks with higher incomes said, it's a percentage of the total cost, and it's not worth my time because I'm not saving as high as a percent. So basically, if you have low income, that is correlated with all biases removed, and you are focused just on this dollar amount. Where people with higher incomes don't think about things in the same terms. So poor people are not bad with money, by and large. Research, and there's a lot more research out there that says that they're better with money. Okay, Poor people increase my taxes. Now, this one actually has some truth to it, right? So in Oklahoma, the average taxpayer in 2018 sent almost $11,000 to the federal government in their federal taxes, which is about $4,000 less than the national average. So we paid less in taxes. But of our $11,000, if you look at these numbers, I added up the ones that like Medicaid, children's health programs, the earned income credit, and TANF. We spend about $1,700 a year of our $11,000 go towards families with low incomes, which is just about $4.70 a day per family. So yes, our taxes are increased to assist lower income families, but by how much? I mean, right? I think it's exaggerated sometimes. Okay. Raising the minimum wage will destroy the economy. Certainly you've heard this. Actually, the Congressional Budget Office put out a report that said that we could raise the minimum wage to $15 an hour by 2025, and that 17 million people would be affected immediately. That's an average increase for 5% pay increase for every family that impacts. It would lift 1.3 million out of poverty, which if you think about this, a lot of times what we hear, this is another stereotype, is that the only people that make minimum wage are teenagers. That is not true. A lot of families live off of minimum wage. And so if we gave minimum wage a boost, it would lift 1.3 million people out of poverty. It would impact not only those at minimum wage, but those between minimum wage and what we're raising it to, which would be $15 an hour in this situation. It'll increase unemployment slightly. That was pre-COVID. It won't increase unemployment now. And then it does impact those above the poverty line minimally. Overall, prices will go up minimally. The ones who are impacted the most are the people with the highest wages, and those folks would be impacted 0.9%. They would see. Okay, we're going to move to welfare is a trap that encourages complacency. This is a very common myth. So scarcity, which we talked about a couple of weeks ago, the scarcity research suggests that it's actually depleted bandwidth, mental bandwidth, that's responsible for poor decision-making. And it's that they're constantly thinking about their finances and due dates and the fact that they're living in deprivation that causes loss of hope. People can't seem to find a way out of it. They see no escape from it. And so it's actually the hopelessness that is mistaken for complacency. Okay. But in fact, underfunded welfare is a trap. And one study that I can point to that shows that is that in Europe, they did a study just a couple years ago that they went across all of the countries of Europe, and it showed that the countries that had higher benefit amounts, that they were more generous with their benefits, that those folks looked for work more consistently than people in the countries that had lower benefits. Now, this makes sense with what we know about scarcity because they're hyper-focused, trying to solve their problems of today. But this also is completely in line with Maslow hierarchy of needs, right? People trying to meet their basic needs today are not planning for tomorrow. They're hungry. So me being hungry right now, I'm probably not going to get dressed up and go look for a job because I'm hungry. I'm going to try to meet that need right now. And the needs that would solve that problem in the future, I can't even think about them because I'm not there, right? I'm not there yet. So the more welfare that we provide, that lifts folks to that place where they are ready to reach out and look for jobs or go to school or whatever it would be to solve the problem of hunger in the future. Okay. Poor people use a lot of drugs. Actually, what we have found through research is that your income is correlated with substance abuse. So the higher your income, the higher substance abuse, you can afford it more. Also, data bears out that drug testing people, low-income people, it's shown us actually that they don't use drugs at that high of a percentage. So in Florida, 172 million welfare recipients were tested, 2% were positive. Again, in Arizona, another 2%. Tennessee tested 16,000 people in 6 months and found 37 people were positive. And then in Oklahoma, we have spent and continue to spend millions testing, drug testing people for TANF. And we are just under 3% at testing positive for drugs. So it's ineffective to test our welfare recipients. It's a waste of money. And it's also not true that they use drugs at a higher rate than the rest of society. So in the last one is the poor will always be among us. Now this one assumes that poverty is just part of our landscape. And I have to tell you, poverty is not inevitable. Other countries have lower poverty rates than we do, so that tells us that it's not inevitable. In the United States, Johnson waged a war on poverty in like 1963. He enacted food stamps, Medicare, Medicaid, WIC, school lunch programs, et cetera, et cetera. And those programs cut our poverty rates by half in the United States. They did a lot. They didn't do enough. We can go further and do better with our policies, but it tells us that poverty is not inevitable and the poor do not have to be among us. If we agree with that, it allows us to continue to say, that's just a state of events. Lucky it's not me. And actually 60% of Americans will live in poverty for 1 year before their age of 65. So it's never that far from any one of us. Okay. And so those are all of the myths. That's what research says about those myths. And then we're just really quickly going to look back at what we talked about 2 weeks ago. Research on scarcity, mental bandwidth, and tunneling says poor people are neither inherently poor at making decisions, nor are they poor at planning for their own futures. Living in chronic deprivation is what creates that state of scarcity, and it limits our cognition because we hyper-focus on the lack of money and time. And that in those situations, every time researchers put people in a state of deprivation through various research studies that have been done, all of us make similar choices when in the similar conditions. So that tells us it's the condition of poverty that impacts our thinking, not that our thinking has put us in poverty. That's really important. And I love this quote, of course, that poor people are not poor because they make bad decisions. They make bad decisions because they are poor. And that's one of the lead researchers from Scarcity. Okay, now let's have this conversation. Ending poverty requires a two-pronged approach. And I get really excited about this conversation because in the United States, for the most part, the conversations that our lawmakers have is that we want to better serve or not people who are in poverty. And most of the programs that they talk about are just about how to better serve people. And we do need to do that. I'm a social worker. I want folks who are living in poverty to have the best services that we can feasibly give them. How do we do that? We need to adjust our existing programs with a few low-cost tweaks that utilize behaviorally based interventions. We know from research that people react a certain way under given circumstances. So we need to change our programs so that they replicate those circumstances so that people will react the way that we need them to react to get out of poverty. It's very simple, and it is a systematic problem. It's not an individual problem. I don't want to insinuate that, but we'll talk about it in a little bit. Also, besides better serving, there's an and to this, and that's the second prong, which is we need to implement large-scale radical programs and policies aimed at ending poverty, not just better serving people who live in poverty, but with the goal of ending it. And that is a conversation that I don't often get to have. So when I do, I get super excited. Okay. Accepting that decisions and actions by low-income families are a universal phenomenon and not a cultural pathology will allow us to move from blame and acceptance to solution-focused policies. And I believe that this is what keeps us from doing that, is that we believe that it's a universal phenomenon. Poverty, poor will always be among us, and there's a cultural pathology to it, the culture of poverty. And I disagree with the culture of poverty. Research shows me it's not true. So once we accept those things as not true, we can move from blame. It's their fault. They aren't working. They aren't interested. They're using drugs. They're bad with money. Can move from those ideas and from acceptance, that we accept that it's just part of our world, to solution-focused policies. And that's where we're going to move today. I know I'm talking quickly. I hope that I have adequately built that case so that we can move to our interventions. So behavioral economics, and almost the rest of this is word for word from a white paper that was put out, and then tons of research has been done on that since then, and tons of research went into that white paper, all of which can be found at Ideas 42. It's an incredible organization. That was built out of the research on scarcity, actually, and all of these researchers got together, compared notes, and said, oh my gosh, from all different fields, we're finding the same results over and over again. Let's put these into action. And so they started a nonprofit called Ideas 42, and that nonprofit now works globally, implementing all of their ideas that they found from research. It's super exciting. Okay, the first thing that they say we need to do is cut the cost, create slack, and reframe and empower. So let's look at, what does cut the cost mean? An overview of that is that families bear the costs of poverty in a variety of ways, and that well-meaning programs will often increase those costs unintentionally by adding hassles and creating complexity. And we know that it is hard to get approved for lots and lots of different programs. It's difficult. So we'll talk about that. And then to support families in a behaviorally informed way, we as the professionals need to identify the drivers of those costs. And it's different. There's 3 different kinds of costs, and then find creative ways to reduce or eliminate them. So what are the costs? They're financial. Earlier, I mentioned that 1/3 of people in the United States are unbanked. That's expensive. When you don't have a bank, not only are you paying to cash your checks and paying to pay your bills, you don't have a place to go when you need a loan for a car or a house. You don't have access to credit cards. You don't have good enough credit to get a bank account. And so, or you can't keep the minimum monthly amount in the bank. So it forces you out of this mainstream way of living. When you get paid, you can't have direct deposit. You have to take a physical check to a bank, cash it, get your money, go buy your money orders. I mean, it's a very complicated system when you are outside of the financial institutions in our country. So that's one thing that we need to think about. Then we have temporal costs. That's our time costs. It's the hassle factor. It is very difficult for someone to take off of work and catch a bus and go downtown and get the appointments and produce all of the documentation that is needed, et cetera, et cetera. And oftentimes, I know when I worked at the Tulsa Housing Authority, we sent them a letter telling them when they would be there. They didn't have an option. And so that's a hassle for people. And then there's the stress of waiting. So if you think about a person who's trying to access services, maybe for like domestic violence, and they call in and they have to wait on the phone, that increases their anxiety. It also could be unsafe for them. So we have to recognize the stress of waiting and the time that it takes in their lives to figure out when they can access services. And then finally, there's cognitive costs. We get decision fatigue. We all get this. In fact, I think it was Albert Einstein that supposedly, I haven't checked this, but he had just 7 suits. They all looked the exact same. So he never had to make his mind up about what to wear that day. He did not want to expend any of his energy making that decision. He tried to reduce the amount of decisions that he made as much as possible. And the mental bandwidth, we've talked about that, which is the attention and focus on one thing, and it reduces our ability to focus on other things, like getting our kids into the dentist, et cetera, okay? So what can we do? What are the interventions? If you're in an agency and you have any voice in how your policies are rolled out for your folks, you need to simplify, streamline, and make easier. Our application and renewal processes should be streamlined. My kiddo just applied for college this year. she just filled out one application. It was the Common App. It went to a majority of the United States universities. Why do we have to fill out applications at every single one of our agencies? We should share. We could come up with data sharing agreements, have a common application. We could also slow the pace of required documents and due dates. And we could also house more of our agencies in one location so that when a person shows up, and we have this for the child abuse, but they show up and all services are right there, easy to access. You're there one time, everything's taken care of. That's one way to do that. We need to increase accessibility. If I've learned anything from COVID-19, it's that we can do so much more this way, right? It's not as great. I would rather see your faces and get excited and all of that. But if we have to, we could extend this to our clients so that they're not having to jump through all of the hoops to come into our office. We can see them over FaceTime a lot of the times. We can adjust our hours of operation to match their needs instead of trying to have a 8 to 5 Monday through Friday agency. If we're truly trying to end poverty, if we're truly trying to serve people better, meet them where they are, then DHS could be open in the evenings and on the weekends instead of during the day when people who are working are at work. And then it cut the attached strings. I'm not going to go on a lot about this, but work requirements don't work. And right now we require people to work in order to get food stamps, in order to get TANF. That's in Oklahoma, and lots of other states across the country do the same thing. Work requirements don't work. They actually send a terrible message, and they don't help people who can't work. Like my father got sick a few years ago, and I had to work part-time because he could not be left alone. If you have to be a full-time caregiver of a parent, you can't work, and now you can't have TANF and you can't have food stamps because you can't work. Okay. The second thing that research indicates is that we need to create slack. Poverty is unforgiving. It leaves no room for error or risk. If you are off by 50 cents in your calculations, it could upend everything for you financially that month. If you get a flat tire, everything, you could lose your job because you can't afford to fix the flat tire. I mean, everything can crumble because there is no slack for people living in poverty. Many of the negative effects of poverty stem from those unforgiving conditions and the havoc that follows those unanticipated shocks or adverse events in a family's life. So we need to, as service providers, build an adequate cushion of time or money or attention and other critical resources in order to help families who are trying to escape poverty. So what are the behavioral interventions that will end poverty? Well, first of all, you have to understand the value of slack that middle and upper class families share. We have automated so much of our lives, right? And the higher your income goes, the more likely you are to have an automated lifestyle. So you have what I mentioned earlier, direct deposit. You have a smartphone that you can pay your bills from because you have a bank account, right? You have maybe housekeepers that come in because you realize that you would rather enjoy your weekends instead of scrubbing your floors. So the higher your income, the more free time it allows for you to have in your life, which then allows you to spend time with your children, to read to them, et cetera, et cetera. So what do we need to do? We need to become unconditionally generous in our benefits. We need to give cash, right? Cash. And we need to give more of it. We need to allow for people who live in poverty to actually have money left over at the end of the month and it not be something that gets their benefits canceled because they were able to save a little money. We need to provide vouchers and certificates only when cash is politically unfeasible. And then I have asterisks by the next of these because these are all actually policies at the federal level that we should consider. We could increase TANF and SNAP benefits amounts and decrease the requirements like the work thing. We need to increase earned income credit amount and also eligibility. Right now, folks who don't have kids don't benefit from that. That's not fair. We should think about extending that to them. Think about Medicaid for all. Everyone's everyone's health being tied to their income is a human rights violation, in my opinion. It makes no sense that because you're poor, you don't deserve health. And then raising the minimum wage. We talked about that earlier. There's behavioral interventions for creating the slack. Value time is money. So when giving folks more money is not feasible, we could gift them more time. So we could have agencies providing laundry services or car services. Childcare could have bus service so that families aren't spending so much time driving and going to the laundromat and doing their laundry, etc. We could ask families what they would find the most beneficial. Obviously, we should always go to our families and ask that. And then when we gift them more time, we don't expect them to use that in a class or doing something very specific. We're gifting them time so that they can use their time in the ways that they see fit, because we believe that they have the agency to plan their own lives. And then last, for creating slack, replace cliffs with slopes. So we could have an assumed approval. If someone comes in and applies for food stamps, we could assume that they're going to be approved, give them the food stamps or the TANF or whatever it is. And then if it doesn't work out over the next month, we can cut off those benefits. But like for childcare, you don't actually get a subsidy for daycare assistance unless you have a job. But how is a single person supposed to go find a job unless they have childcare? And so it's this weird cycle that they're in, right? We could say, yes, you're approved for a month for childcare. Go find yourself a job, or get enrolled in school, whatever it is that you need to do. And then also the slopes benefit off ramp. So right now it is very much, if you make this amount, you're approved. If you make this amount, you're denied. And if you work here and you get a raise and you get another raise, now all of a sudden this 1.25 an hour raise has cut off all your benefits. So actually, people who live in poverty say, don't give me the raise. I can't afford the raise because I'll only get $20 more a week and I'll lose $300 worth of benefits. Okay, so we need to slope that. Okay, then we need to establish some safeguards. Organizations and policymakers can coordinate cash benefits. So if you think about when TANF arrives, the check, I looked this up and it arrives around the first of the month. We know rents due around the first of the month. If we sent TANF checks a few days earlier, and then landlords could have their money on the first instead of waiting for the tenant to get the check on the 3rd or the 5th, and no more late fees, etc. We could send timely reminders through appropriate channels. Research has indicated that if you send someone a text, if you're a literacy program, and you send someone a text at 6:30 at night that says, don't forget to read to your kiddos tonight, here's a suggested book, it increases the amount of people who read to their children significantly. And it's about the timing of it. So you don't want to send them a text at 3 o'clock reminding them to read to their children. And then it's also through an appropriate channel. So sometimes we try to reach folks through mail, but people in poverty tend to move more often, so they don't get those reminders. So if we could set something up where we're texting our clients to remind them of things, and I think a lot of folks are doing this, but this is out of the research. So, and then finally, we could build in backstops. So it's got an asterisk by it. That means providing affordable credit opportunities really falls to our government, but agencies could provide low to no interest grants or loans to get folks through just that week or two, I'm getting paid, but my rent is due, or et cetera. Agencies could do that and help folks so that they're not turning to the high interest check cashing places in their communities. And then finally, reframe and empower. So this one we're going to have to go through pretty quickly. But to succeed in the enormously complex task of escaping poverty, you must first believe that you have the ability to affect your life. Unfortunately, many of our systems and programs reinforce or create stigmas that systematically disempower people rather than affirming their autonomy and dignity. So if you think about your policies, the language that you use, our behaviorally informed systems and services are crafted to help people do more of what they want and make sure that your agency is a partner in that. You need to use intentional language. So think about what we call people. Do we call them social workers or do we call them advocates, right? Advocate just sounds like you're partnering with your folks. And then this one, family location in the org chart. This is not in research. This is something that I teach in social work. This org chart's my favorite. It was given to me by the director of the campfire, a dozen years ago. But if you notice, it's flipped. I call this flipping the org chart so that it's a visual representation of the executive director being on bottom and being in a position of assistance to help, to serve everyone above them. And when you put your clients at the top, and your executive director and your board of directors at the bottom, it's a mental shift in the way that you see your organization and what the role is. Instead of a top-down authority, it's our bottom-up support. Leverage position identities or positive identities. There was a study put out that said that they took Asian women and had them talk about being a woman for a couple of minutes and what it was like to be a woman, and then gave them math problems. And then they took Asian women and had them talk about what it was like to be Asian, and then had them do math problems. And lo and behold, the ones who had to talk about women, or talk about what it was like to be a woman, did far worse than the ones who talked about being Asian. And they believe that's because there's stereotypes around women aren't supposed to be very good at math, but Asians are. Kind of interesting. So it just means we can help our clients by helping them talk about their strengths. Treat families as the experts, of course. We need to confront our biases, which we talked about the myths earlier, if you can confront those with other folks in your lives. And then create possible pathways out of poverty. There's a wide gap between what people in poverty aspire to and what they actually expect to happen to them in the future. So closing thoughts. Research indicates that myths surrounding poverty are largely untrue. Poor decision-making has been correlated with limited mental bandwidth caused by the condition of poverty, not the other way around. There are policy solutions that will end poverty. Allowing poverty to continue is a choice that we all make every day. And poverty will end when we decide that the human rights violation is too great a price to pay. All right, any questions?
Thank you, Gloria.
Yes.
Christina, are you with us?
Yeah.
Okay, so they already started with questions, but there is a note from one of the participants that I think it's important that you will read it.
Okay, no problem. So I'll start with the note first. The note says, my son was born with a birth defect and had to have multiple life-saving surgeries throughout his life. And due to us making too much money once, I was able to get a job after he was stable enough. We lost his Medicaid and disability. It's a shame that there are so many families out there who need the extra assistance, but make too much money, or so they say.
Yes, that is terrible and tragic and exactly what I'm talking about.
Right. The next question is, do you have any tips for advocating this shift in your organization?
Well, show this presentation. No, really, I think that, so Gal and I have partnered a lot of times, several times, to go out and talk about poverty in the poverty simulation and different talks. I think that it's important. It's such a different paradigm. It's just a paradigm shift of where we generally think, what we generally think in the US about folks living in poverty. So I think you have to start with things like the poverty simulation and trainings for the folks who are making the decisions. And there's funding for that. There's pathways for that. That is not impossible. I think if you reach out to Gal or myself, we can help with that. And then, I've been thinking about putting together a curriculum of sorts so that it would build I feel like there's so much information in 45 minutes. I'm just like fast talking, right? But I feel like building a curriculum where you start with a poverty sim and then you could move and hear different talks a couple of weeks apart for people who are making the decisions in programming is a great way to begin.
Awesome. The next question is a really good segue. Do you have any tips for engaging in policy change?
Well, so a couple of weeks ago, a few people reached out about trying to get the poverty simulation in front of lawmakers, which is the dream, right? We would love for them to set aside 3 hours of their lives and go through that. I would say that, all of us are connected here in Tulsa to various different people who run agencies, who are city councilors, our state representatives. I feel like the more we have these conversations and the more we reject those stereotypes and we show them over and over and over again through research that it is not true. What you are saying is a trope. It is not the truth. Eventually, but we're in Oklahoma. And so it's unfortunate. I hate to admit that, but we're really, really fighting an uphill battle. We're the reddest state in the nation. And we really believe that poor people are poor because, that's the way of the world. It's not very helpful, is it? I'm sorry.
So for the next one, have you shared this information with any Oklahoma lawmakers or advocated to them that this information to educate them on these topics they likely don't even understand? Which you kind of heard in the last question. So
a few years ago when I was with the University of Oklahoma, one of my jobs there was it was a national sort of an organization. It was a national effort, and they chose one university out of every state to get all of this training, one person at the university, that was me, to get trained, to understand how to talk to lawmakers, what information we would be presenting, and then using all of the research that our universities were putting out, but also what other universities were putting out across the country, and present that in ways that would impact policy. And none of our policymakers, well, one, and then she was voted out the next year. She termed out the next year. And she was local, like a state representative. But none of them returned our emails. None. So no, I've not been successful. And I'm pretty convincing. And I'm a dog with a bone. So it wasn't that I didn't try, I just didn't succeed. But I'm still willing to keep trying.
We all should.
Mildred, are you with us here still?
Yes, I'm still here.
Hi, I just saw what you wrote. Can you explain it a little bit, what you meant?
Well, what I wrote was that I'm wondering, since there are new people in the food line right now, a lot of people unemployed, a lot of people see what it feels like not to have the paycheck coming in. I'm just wondering, how likely is it that the majority of us will start to change our mind and our thinking about poverty and people who live in poverty once we have truly experienced it? And when you see the people in those food lines, they've never been in that before. They say, have you ever been unemployed? Never been unemployed before. And sometimes during that period of time, it may offer them an opportunity to say, wow, maybe we do need to change some policies or some things that, impact other people's lives. I just remember I was unemployed for a little bit of time because I was getting ready to go back to school. And that was back in the day when you had to have all this ID and stuff to cash a check, right? To write a check, to purchase something. And she was all distressed because she said, well, where do you work? What's your work phone number? And I was like, ma'am, I don't have one. But I have money in the bank. I just don't have a work number right now. And it is very defeating to people who have to experience that for the first time. That's what I was thinking about, is that this COVID has brought poverty really to light for a lot of different people.
Yeah, absolutely. That's a great point. And, you know, perhaps when we're on the other side of this, it would be an opportunity to capitalize. I mean, I hate to put it that way because it's a tragedy, but if we could turn it into a positive, saying, you know, how many families fell into that and how close we all are to it all the time. People don't realize how close they are to living in poverty. Like I mentioned in the talk, you know, almost 60% of Americans will live in poverty 1 year of their life between 18 and 65. And I think that right now that number is happening. You know, that's what's happening for a lot of our families. And so, yes, that's a great point and gives me something to really think about moving forward.
I'm just wondering, since you read a lot and you research, if you'll just keep up with the research about that, just show us if there's anything that truly changed as a result of this. Were there more people in Oklahoma that voted a different way? Did that change the voting at all? Did that change our beliefs about the Medicaid expansion? Is this going to make a difference? Because it seems like, again, Oklahoma, the reddest state, the poorest state, and sometimes we do things that we shoot ourselves in the foot. You know, we will do things that we know is detrimental to us, whether it's because I'm a red state. So I'm just wondering if some of that mentality will change as a result of this.
Yeah, you know, we should all run for office. I say that sort of tongue in cheek, but really not. I mean, why not? Why can't we run for office? I think that the options that we're presented with do not give us the opportunity to really change the landscape in Oklahoma. We're not, I mean, maybe I'll run for office. Who knows? Maybe you should run for office, Mildred. Jasmine, you should definitely run for office.
Awesome. So the next question, I'm sure you find a great deal of stigma surrounding clients and they're applying for benefits, mental health, etc. I missed the earliest part of your presentation. Was there much research surrounding these thoughts, stigma, mental health, etc.?
There were myths about people who live in poverty. I didn't talk much about mental health, but certainly we know that statistically folks with mental health challenges and also then be underinsured or uninsured, then more likely to be in poverty. So all of that follows each other. But there are definitely, yes, I did talk about a lot of the myths surrounding people who live in poverty. Yes.
Thank you, Gloria. That's all the questions we have right now. We still have a minute or two if anybody has a last minute question. Thank you so much for your time, for your presentation, and the discussion on this one was really awesome.
Yeah, thank you all. Thank Gloria for this opportunity for us to be together and to talk about those important issues. And I just must tell you that the poverty simulation, it's really, it's a very important tool that you can use to bring people to the understanding of what is poverty. I joined one of them as a participant, and it was a huge impact on me. I must say that it was like the first time that I was like, wow, this is how a poor people feel, and it was like overwhelming. I went with these feelings for many weeks. So I'm just really, I mean, it's a very, very great opportunity to bring people to the understanding of what is poverty, what is to live in poverty, what is children in poverty, and to break some myth that Gloria talked about. So I really invite you all to use us. Contact Gloria, contact us, contact Esther from Haruv. We will be able to do it. So thank you all very much. Thank you.